Often reforms walk in the garb of necessity but conceal its plutocratic objective. Reforms without structural rethink creates the problem of access and equity for the majority, particularly the poor. Though in the short term the plutocrats will gain, there is a limit to their growth without the structural reform. Not only the social conflict will divide the society, new resistance will come up and the growth will reach the dead end to their dismay because the consumers with discretionary income will not be available to demand the products they produce. It is time to red flag our healthcare preparedness. Meet Satya Brahma, the visionary chairman of Network 7 Media Group, who's connecting the dots as he says, "I understand that we don't have a magic wand or a fiction Superman to fix the healthcare chaos and challenges, but at least we have the resources to build the healthcare infrastructure." So where are we now? Zero. Satya says that there are two main reasons for poor healthcare coverage. First, we don't have enough trained medical personnel. The World Health Organization recommends a ratio of 1:1000. That is, we should have one doctor for every 1000 persons. For India, the doctor population ratio statistic is unclear and murky. We do not know whether we have one doctor for 1700, 1500 or 1000 persons. We lack clarity because we do not know how many doctors are registered medical practitioners, how many practitioners are still active, how many are out of practice, and how many are quacks. This is one of the major reasons for poor healthcare in India. We don't have enough trained medical personnel. The government admits that more than 75% of the primary healthcare system is managed by people who are not qualified to practice medicine. The Medical Council of India is deeply compromised. India never planned its healthcare system properly. Politicians have no domain expertise. Doctors, nurses, and medical professionals are cut out of policy making. Satya believes that only bold action, not policy tweaks, will bring victory over COVID. India has the capability and the opportunity to become the vaccine superpower of the world, but India's healthcare system is in shambles. COVID-19 is notoriously hard to control, and political leaders are only part of the calculus when it comes to pandemic management. I believe that the situation in the country is worst and man-made. The images coming from India over the past few months are gut-wrenching, and I do not just mean metaphorically. Trails of pyres for as far as the eye can see, scores of people dying outside hospitals, family members desperately searching for oxygen cylinders for their loved ones. India looked like a war zone where people lost their lives to the enemy. Things would have been different had the enemy's potential not been underestimated. It is time to admit our mistakes and accept the reality. In democracies, governments are expected to take responsibility when actions go wrong. We are not ruled by dictatorship, but democracy. Let's not forget we can defeat the virus by lighting diyas and beat thalis from balconies and clap for 9 minutes. We need sustained campaigns and rectifying our past mistakes. The need of the hour is to build the capacities of the existing healthcare workforce equipping them with the skills and knowledge to provide quality healthcare at the local level. I believe that despite the chaos, devastating impact of COVID-19 pandemic in our lives, I need to share the success stories of how you have struggled to make an impact. Every crisis leads to an alternative system, and that alternative system is nothing but a significant healthcare innovations. Your innovation stories need to be shared to the world. Pharma Leaders is always passionate about your entrepreneurial journey, even when the whole world is clueless what the future will look like. Join me as I share your innovative success stories at the 14th Annual Power Brand Awards 2021.